Live from KTTC in Rochester, Minnesota, you're watching the 2022 Minnesota gubernatorial debate with Governor Tim Walz and Dr. Scott Jensen, moderated by KTTC's Caitlin Alexander, KVLY's Justin Betty, KEYC's Stacy Steinhagen, and KBJR's Dan Wolf.
Good evening and welcome to the only planned televised debate between Minnesota Governor Tim Walz and his Republican challenger Dr. Scott Jensen. I'm Caitlin Alexander with KTTC and welcome to the 2022 Minnesota gubernatorial debate hosted by Gray Television. Many of you are watching Gray stations across the state and may recognize the familiar faces joining me on the panel tonight. Dan Wolf with Northern News Now in Duluth, Justin Betty from Valley News Live in Fargo-Moorhead, and Stacy Steinhagen from KEYC News Now in Mankato. Each of us have worked together to come up with questions for our candidates tonight. We have not shared those questions with anyone outside of our station's management. Dan Wolf will serve as moderator and timekeeper. He has tonight's rules. Dan.
Thank you, Caitlin. Good evening. Tonight will be a forum-style debate. Each of you will be asked the same question and get 90 seconds each to answer. For variety, there are several short answer-style questions where you'll have 30 seconds to answer. Panelists will make those questions clear when asking those. And to cover as many topics as possible, we ask you to stick to your time limits. If you run over, I will step in and move us along. There are no opening statements tonight. Instead, you each will get 2 minutes to close out the debate and share any final thoughts. We will alternate between who starts each answer by virtue of a coin toss. Governor Walz will answer first. We'll start with Caitlin Alexander with KTTC.
All right. Rochester is home to the world-famous Mayo Clinic. Thousands come from around the world each year for treatment. Healthcare spending topped $4 billion in 2020, and the cost of healthcare continues to weigh heavily on families in our state. Can you point to one specific policy or initiative in your platform that will help lower the cost of healthcare for Minnesotans? What will you do as governor to help lower those costs? Governor Walz, you'll begin.
Well, Caitlin, thank you for the question. Thank you to Gray TV for hosting, and thank you, Minnesotans, for caring enough about your democracy to join this. Healthcare is fundamental to each and every one of us. We've seen it over the last 3 years, an unprecedented global pandemic, and access to be able to get that healthcare, to be able to get the vaccines you needed, and be able to get the life-saving care when you needed it. But we know it's become way too expensive. One of the things that we know is making sure that people are insured on the front end so that they're able to get the preventive care that's necessary. We've been advocating and have expanded on Minnesota Care here in Minnesota. We were able to make sure that the provider tax stayed on that allowed that care to be delivered. We saw just this last week that Minnesota ranked first in the nation for women and children's health care. Our initiative has been to get more children involved in this, to do more of the well care, to make sure that we were reaching out to all corners of Minnesota to keep the prices down. Another thing that we continue to focus on, and we saw it with insulin, is to make sure the prescription drugs going down. I'm grateful for the federal government's work on the Inflation Reduction Act that helped do some of that. Here in Minnesota, we continue to do that with Minnesota Care. We continue to do that in our veterans' homes to make sure that we're able to keep the price of prescription drugs down. But the biggest thing in Minnesota is we have one of the highest amount of people who are insured. We have some of the best health care providers. We have some of the best preventive care, and we saw during the pandemic, we come together to solve those problems.
Thank you, Governor Walz. Dr. Jensen, you have 90 seconds.
Thank you. We do have wonderful health care in this state. And I would say this, Mayo Clinic, the University of Minnesota, Abbott Northwestern, CentraCare, and so many of our systems have done such a good job. I think reinsurance was one of the things that has really helped Minnesota keep the premiums manageable. I think the other thing that's happened is we've worked together on insulin. Tim Walz and I did that together. People don't realize it. Back in the day, insulin was a penny a unit, and now it's 40 cents a unit. We need reinsurance to keep the premiums down. But right now, in terms of the exchange, we still do have problems. We have rate cliffs where people are all of a sudden falling off that advantageous place to be. And all of a sudden, instead of paying 10% of their income for premiums, they go to 20, 25, even 30%. That's a problem. We need to make sure that everybody can have their appendix removed without sitting at home too long because they're worried about whether or not they can afford it. I would disagree with Governor Walz in the sense that I think the MinCare tax is a Machiavellian way to pay for the cares we need to provide. Absolutely, we want to make sure that every Minnesotan has basic coverage care. But when we create a system where the essential health benefits are such that everybody's being demanded that they have some sort of a B&W plan, it's too much. We can't afford it. So right now we have an awful lot of people, 5 to 10% of the population that don't have insurance. But we have a whole another big chunk of people that do have insurance, but the deductibles and the co-insurances and the co-pays are so much they can't use it.
Thank you, Dr. Jensen. Let's go over to Justin Betty with Valley News Live.
Thanks, Dan. A recent decision by the U.S. Supreme Court overturned Roe v. Wade, no longer guaranteeing women the right to an abortion nationwide, leaving it up to states. Our station's right on the border of Fargo, North Dakota, and Moorhead, Minnesota. So in North Dakota, abortion could and is expected to soon become illegal in most cases under a trigger law. In Minnesota, abortion is still protected under the state constitution, Roe v. Gomez, but that could change. So the question is, what, if anything, would you do to change abortion law? We begin with Dr. Jensen.
In Minnesota, abortion is a constitutionally protected right. And the only way that really feasibly gets changed is through some sort of an amendment ballot. And that would mean that 4 million Minnesotans would have the chance to decide where Minnesota comes down in this position. But because, and I think Tim Walz has said this, as has Keith Ellison and numerous legal experts that I've talked with, because in Minnesota abortion is a legally protected right, it is not on the ballot in November. What is on the ballot in November is, without question, skyrocketing inflation, crime out of control, and our kids aren't getting the education that we think they need. As governor, I won't ban abortion. I can't. As Governor Walz has said, no governor can, no politician can. But I do want to say this. As governor, I absolutely want to come alongside of women, and I want to support and protect them. This is our opportunity. We need to do more. We need to share the responsibility and the challenge of planning families and planning pregnancies. I think we should have birth control pills over the counter. I think we should have a $10 maximum per month. I believe we should have paid maternity health benefits when moms have babies. And I think we should streamline adoption proceedings, and we should have a tax credit associated with it. I also would like to see us stiffen the penalties for those crimes that target women, such as carjacking and rape. But abortion clearly is not on the ballot in November.
Thank you,
anything
Dr.
said
Jensen.
to the contrary is just fear-mongering.
Thank you, Dr. Jensen. Governor Walz, you have 90 seconds.
Well, there's a clear contrast here. My entire career, I've trusted women to make their health care decisions. I don't believe anybody who sits in this office should come between them. Scott was very clear in May. He mocked me and said, no kidding, Sherlock, I'm running for governor to get things done. We're going to ban abortion. That's not news. That changed after Roe versus Wade. And I think what most of us know, again, you heard this go to many different places, this is not about trusting women. It's not about holding clear convictions. It's about changing your positions as the winds blow. This is about life and death. This is about providers making the most personal decisions with a woman with nobody else in between them. I've made it very clear in every single thing I've done. I didn't have to practice 40 years of medicine to change the positions on women's health care in the final weeks once we saw how unpopular this was. So what I'd speak to Minnesotans on this, being governor means making hard decisions. Doesn't mean you're always going to get them right, but it means trusting Minnesotans. So let's just be very clear. The governors appoint Supreme Court justices who interpret cases and come in front of them. We heard Supreme Court justices go in front of the United States Senate and claim that there was no way Roe versus Wade would change because it was settled law. Well, fool us once. It's not going to happen here in Minnesota. I just want to be absolutely clear. This is on the ballot. It will impact generations to come, and I have been absolutely clear from the beginning of this. Not on our watch. I trust women. I trust them to make their own health care decisions.
Thank you, Governor Walz. Let's go to Stacey Steinhagen with KEYC News Now.
Many of our viewers have reached out about the ongoing opioid crisis affecting communities big and small. According to the Minnesota Department of Health, nearly 1,300 people in this state died last year from an overdose. That is up 20% from 2020. Now, rainbow fentanyl pills, looking like candy, have reached Minnesota. Authorities first finding the brightly colored fentanyl, which could appeal to kids in Mankato last month. As governor, what specifically would you do to address this ongoing crisis and save lives? The question going to Governor Walz first.
Yeah, the opioid crisis, and it continued to accelerate. We've seen this in Minnesota. It's even disproportionately hits our communities of color, especially our indigenous communities. Certainly the idea of stopping them at the border, but there's a lot of things that we can do on the front end, making sure that we're stopping that demand, making sure that we have the services available. I want to say one thing I'm really proud of in Minnesota. Minnesota was one of the states that sued the manufacturers who were making this. This opioid pandemic started, and some of you have seen the shows, you've seen the documentaries that have been done on this, that they started pushing these things for profit and ended up spreading into our communities. That's where most of this has come from. And I have to say, I want to be very clear about this. They didn't do it alone. When Scott was issuing opioid prescriptions, he issued more than 94% of his peers. He did that at the same time while accepting meals from the manufacturers and the pharmaceutical companies, wining and dining on expensive meals. And then he did an expose that was in the Minneapolis Star-Tribune that was entitled Confessions of a Prescription Drug Pusher, where Scott acknowledged that their impact on him and marketing impacted his prescribing of those. It's getting at the front end of this. It's understanding why it got it out there. It's doing what the state of Minnesota did, suing, and then putting in processes to both capture the opioids before they get there and working with folks who are in recovery. Minnesota can do that.
Thank you, Governor Walz. Dr. Jensen, you have 90 seconds.
Without question, the fentanyl that plagues us today is taking a tremendous number of lives. I think over 100,000 drug overdose deaths in 2021, and 2/3 of those were fentanyl. In the 1980s and the 1990s, there was absolutely a heavy-duty pharma push to encourage physicians to use more narcotics and opiates. We actually had another vital sign, which was the pain management level. What's your pain level, 1 through 10? And if we didn't ask that, we weren't, quote, doing good medicine. So I don't disagree with Tim Walz. Physicians and the healthcare system have contributed to the problems. And in terms of going out to dinner and having an educational event, yeah, that could happen as well. But I think the important thing is going forward, we need to stop the supply of fentanyl coming from across the southern border. And I don't think Tim Walz has been an advocate of tightening up the southern border. He's been loose on that, if you will. But I also think that it's interesting to me that he's willing to go out and sue drug companies, which I'm okay with, but he's not willing to go out and take action like that when we're losing $250 million in the Feeding Our Future fraud. In this situation, we had a clear situation where Governor Walz learned of the fact that there was fraud going on. We still can't pin him down as to whether it was April or the summer or November, but the fact is he broke the law by not advising the Office of the Legislative Auditor that there was likely fraud going on.
Thank you, Dr.
Governor
Jensen.
Walz broke the law.
Thank you.
We'll be addressing fraud later.
Yeah, we'll get to that a little bit later here in the debate. On now to one of our short answer questions. You'll each have 30 seconds to answer this. Minnesota is surrounded by states that have legalized sports gambling, but some of them have not legalized it on mobile platforms. In 30 seconds, will you push for legalized sports gambling and the ability to bet via mobile devices? Dr. Jensen, you have 30 seconds to answer.
I would say yes and yes. I would support sports betting and mobilized platforms is fine. I do think that it's important to realize, though, that we need to do this in an effort to secure funding for meaningful programs. We cannot, if we move in this direction, simply take money from that and allow, if you will, politicians just to find another way to find another pool of money and spend that. We need to do this because government doesn't need to be regulating this.
Okay, thank you, Dr. Jensen. Governor Walz, will you push for legalized sports gambling and the ability to bet via mobile devices? You have 30 seconds.
I will support the bills that the legislature pushes on this. I don't know if I'd say I would push it, but I think we need a framework to make sure that it's done right, a framework inside our already existing gambling revenues and gaming revenues in Minnesota. I would argue I trust Minnesotans. That's why I would also think that we should legalize recreational cannabis. The one thing is the revenues from sports gaming are relatively small compared to some of the other things we do. But yes, I would certainly support us doing it right, but I also know that we need to manage that from the state level.
Thank you, Governor. Justin.
We're getting a clearer picture of how the COVID-19 pandemic is impacting our children's education. A federal report shows math and reading scores dropped significantly the first 2 years of the pandemic. ACT scores the lowest they've been in 30 years. So what would you do as governor to direct the state's resources and to help Minnesota's children succeed in schools? We start with Governor Walz.
What we've always done, that we prioritize them first. We fully fund our schools. We make sure they have the support. We make sure that our teachers, our parents, and our students and the support staff are there. I think we know before the pandemic and that there were things that we can do. Minnesota still ranks very near to the top. The pandemic did have it. If you conveniently forget that 1 million people died, the implications of trying to make those difficult decisions at those times, and most folks agree that those decisions save lives. With that being said, now is the time to reinvest and know what we learned. Our ability to be able to use different methods, I know this as a lifelong educator myself, students learn at different levels. We've seen a lot during the pandemic. One of the things we saw great resiliency amongst these students, and now once we have them back in the classroom, we're doing new ways of making sure they're able to get content. I think one of the things Minnesota had the opportunity to put another $1 billion in to close the cross-subsidy on special education. That deal died in May in the legislature, but we can come back and make that the case. We know in Minnesota that we see this in housing, we see it in health delivery, we see it in education. Our diversity issues on children of color, making sure that we close that gap. While Minnesota students of color do better than almost every other state, there's still a gap between white students. I think one of the biggest things we make sure that local control has the ability to be able in those school districts to make those decisions, and the state makes sure that we provide the promised resources to these incredibly important our most precious resource, our children, but also making sure we deliver that. We deliver it in a manner that the results that Minnesotan parents want.
Thank you, Governor Walz. Dr. Jensen, you have 90 seconds.
I heard a lot of words there, but I don't quite know that they made a lot of sense. So I think Governor Walz said that people of color or students of color are doing better in Minnesota than they are in other states. I'm not certain. But I would say this. When Governor Walz says we need to fully fund education, who knows what that means? I mean, we spend 150% of what an awful lot of states already spend per student. We spend more per student than any of the other neighboring Midwestern states. At some point in time, we're going to have to ask the question, are we getting what we're paying for? We need to start funding kids, not broken institutions. Frankly, teachers understand that they could be unleashed and do so much more. The teachers aren't crazy with what the Minnesota Teachers Union is doing. We need to unleash teachers and parents and kids to work together. But we have got to deal with the fact that right now, approximately half of our kids aren't reading or doing arithmetic to grade level. Understandably, in the first couple of weeks of the pandemic, we understood that hard things would have to be done. But when Tim Walz said that 80% of kids in Minnesota miss less than 10 days of in-classroom instruction, he was basically telling the parents, you don't know what you're talking about. The fact is, they probably missed more than 100 days of school. And in the second lockdown, there was no reason for the governor to be so heavy-handed and destroy our children's education. We don't get a do-over with these kids. These kids are going to be paying the price of Tim Walz's irresponsible policy decisions for years to come.
Thank you, Dr. Jensen. Thank you. All right, let's go over to Stacy with the question.
One of the candidates for Nicollet County Sheriff has served that department since 1994, and he has said that they need a better plan to respond to a school shooting. The confirmed abject failure of law enforcement's response in Uvalde, Texas, weighs heavy on this entire country. What can you do as governor to make sure parents and students are confident school is a safe place to be? Dr. Jensen, this question goes to you first.
There's no question that we have got to do a better job of providing a safe place for our kids, but we also have to provide a safe place for our teachers. Both our teachers and kids are vulnerable in the school buildings, and we're seeing that more and more. Teachers are being assaulted. We're seeing kids, teachers, parents being, if you will, victimized at football games every Friday night. This is a product of a lawlessness that's swept over our state, and it started with Tim Walz delaying in May and June of 2020. He unleashed, if you will, a poisonous spread of lawlessness. Arguably, he is the godfather of the crime epidemic that has swept our country. I think what we can do with kids in school is we have to look at new things in terms of controlling access points. But we also need to recognize that the police are going to have an awful lot of expertise at how can we do this better. We need more cops on the street corners. We need restorative justice programs, and we need to respect the work police do. It isn't going to help us when we see the governor get behind Ilhan Omar when she comes out and says the police are a cancer and need to be dismantled and defunded. And a few weeks later, Tim Walz is telling Minnesota, this is the woman that we have to send to Washington, D.C. to represent us. We need to make certain that imprisoning people is a deterrent for violent felons. We absolutely need to have mandated minimum sentences, and without question, the laws have to be enforced. We can do so much better, but if we think that we can cherry pick just the schools and make them safe
Dr.
when everything else runs amok, we're kidding ourselves.
All right. Thank you, Dr. Jensen. Governor Walz, you have 90 seconds.
Yeah, we've seen this in being a teacher and having a sophomore in high school. This doesn't happen in other countries. And this plague of violence we see, and I will make the case that these school shootings of children who can't even be identified because of the damage that's been done by these shooters that end in their schools. There's things that we can do. One of the first things we can do is making sure, and every one of my budgets did increase the opportunity for public safety. We had a $450 million budget this year that was killed in the legislature when Scott told the Republican legislator to step away from that. That's money that we increased in LGA to allow for more. But it's much more than that. We have guns on the streets that were meant for war. We have the opportunity to do smart things, whether it be background checks or making sure we have red flag laws. In many of these cases, once we go back and deconstruct this, the easy access to these firearms is one of the problems. We see that in our streets today. A shooting at the Truck Park restaurant in St. Paul, the person who ended up with 2 of the guns there got them through a straw buyer who bought 90 of them in the month prior. So we have to have a conversation about guns. We have to have a conversation about fully funding our local police to get there. We need to make sure that we're doing all we can to understand that if you use a gun in a crime, it's going to be a heavy cost to it. But we need to move back upstream in the prevention of that. One, of making sure that those guns aren't on the streets, making sure we have smart policies in place.
Thank you, Governor Walz.
That was my follow-up question. Who should have these military-style weapons, Dr. Jensen?
Well, the rebuttal has to be focused on who shut down the session. Tim Walz, Democratic chair in the House, confessed that the governor would not allow the Democrats to vote. Tim Walz shut down the session. Nobody else did. Tim Walz is the governor. There's only one person in this state who can call the legislature back together, and that's the governor. You're giving me an awful lot of credit, Tim, and I appreciate it. I didn't know I was so powerful that I could shut you down and you didn't even come back. You had every opportunity. And by the way, I think you better check your research.
Thank you, Dr. Walz.
And on the access to guns, Dr.
in places
Jensen?
other than in
Thank you,
America.
Dr. Jensen, on the access to guns, your answer is?
And access to guns, I signed on to a straw man bill and I kept my name on that bill. So I agree that straw man purchases should be stiffened penalties in regards to specific types of guns. I'm a strong advocate for the Second Amendment. These shootings are not happening because lawful people are not following the law. These shootings are happening because lawbreakers are going to get the guns, and they're not going to go through the system.
Thank you,
so I think
Dr.
if we think
Jensen.
that that's going to solve the problem, we're kidding.
And Governor,
I don't believe that.
Governor Walz.
That at all. That is untrue. And Scott's been all over like he is on every issue. The Moms Demand Action, Dr. Jensen told the group of them that you could trust his integrity, he'd be with them on the bills, and he wasn't. As far as shutting down the legislature, Dr. Jensen was in the Senate. He knows how it goes. The governor can't do this alone, and his public statements were very good. Walk away from this deal. Don't give them a win. Just so Minnesotans would know, we would have had $450 million for public safety, $1 billion for health care. $4 billion would have gone back into your pocket in the largest tax cut. As governor, I'll make sure we follow through.
Thank you, Governor. We have to move along now. Moving to the next question. This year we saw soaring gas prices. Summer restrictions on cheaper E85 ethanol fuel were loosened, but drivers still felt the hit. States like California are moving to ban the sale of gas-powered vehicles by 2035. Minnesota has always followed the Golden State's emission standards, but this move has drawn serious concerns from Minnesota businesses and farmers. As governor, how do you balance the need to lower greenhouse gas emissions and keep freedom of choice for consumers? Governor Walz, you have 90 seconds.
That's exactly right. The market will help fix this. It's one of the reasons that I'm the national chair of the Governor's Biofuel Conference. I've been that for decades now. I've worked on it in Congress. Our future fuels are going to be made right here in Minnesota. The cars that are on the road are going to be on the road for decades. But this transition to making sure that we're addressing greenhouse gases and following where the market is going. Many of the manufacturers, GM by 2035, will only be producing those vehicles. It's why Minnesota went on the initiative to make sure that we're going to be a state that builds the infrastructure necessary for the charging stations, making sure now that Minnesotans will have a choice of over 40 vehicles rather than the 8 that they were limited to. If you don't want to buy one, don't buy one. But if you're going to buy one in Minnesota, we have the opportunity to continue to grow our economy, to continue to make that transition, to understand that that is where the market and the climate is going. Now, the good news here is from the businesses, it's a pretty limited number because we have a climate action plan that attracted almost all the major businesses in Minnesota, whether it's Xcel Energy producing the power, whether it's Ecolab understanding what the climate looks like, or whether it's our environmental groups that understand if Minnesota has a plan to reduce emissions, especially in the area of transportation, we have a golden opportunity. So this is a win-win-win. Our farmers produce, lead, and have been the pioneers, and I have led on so many of those initiatives on E85 and the next fuels that are coming, coupled with our transition to plug-in and hybrids. Minnesota is going to lead. We're going to have an opportunity to grow, and it's your choice what you buy.
Thank you, Governor Walz. Dr. Jensen, you have 90 seconds.
This is astonishing. This is just politics as usual. By forcing Minnesotans to buy electric vehicles they don't want so that in 2035 all new vehicles are electric vehicles, Governor Walz is telling Minnesotans that he's allowing you to follow the market. No, he's forcing the market. He's forcing inflationary pressures on all Minnesotans. He hasn't come up with his own tailor-made plan. He simply copied California over and over again. He put the largest biennial general budget forward last session in the history of Minnesota. It has never gone up that many dollars. He has told Minnesotans, you don't get to buy the cars you want to buy. I am going to force feed you. He has told the farmers, I am with you on biofuels. And on the other hand, he says, but we're going to completely electric vehicles, and electric vehicles don't run on biofuels. He's told the northern part of the state, you're not going to be able to mine because I don't trust you. And then he tells us that the things we need in order to have electric vehicles, we're going to produce in Minnesota. It doesn't add up. I hope you see this, people. This is crazy. Tim Walz is saying, no, you can't mine nickel and copper. He's saying to the farmers, I'm with you on biofuels, but then he says to this group, we're going to have electric vehicles and none other. He wants to get rid of internal combustion engine vehicles. You can't have it every which way. This is just a word salad with no substance.
Thank you, Dr. Jensen. We will get to the issue of mining here in just a couple of moments. Let's get over to Caitlin.
I have another short answer question for you both. You'll each get 30 seconds to answer. Other than thanking them for being willing to serve in office, what is one nice thing you can say about your opponent? We'll begin with Dr. Jensen.
I've thought about this question. I think Tim Walz is an affable individual who has a wonderful smile.
Thank you, Dr. Jensen. Governor Walz, 30 seconds.
I think Scott has shown a great affinity, I see, as he talks about his family, talks about how important that is to him. I think that's always a pretty good indicator of where someone's heart's at, and I myself always appreciate that when someone puts their family first.
Thank you, Governor Walz. Let's get over to Stacy.
Agriculture is a driver of the Minnesota economy, adding more than $112 billion a year and creating more than 431,000 jobs. COVID showed us how fragile the food system is. What can you do to enforce policies to protect the state and those working within agriculture to ensure all Minnesotans have access to a safe and steady food source? Governor Walz, this question is yours first.
Well, this is an area I'm incredibly proud of, from working on farms growing up to serving 12 years and being a subcommittee ranking member in the House Agriculture Committee, passing 3 farm bills. I recognize and have deep roots and deep relationships with the people in Minnesota. We do feed, fuel, and clothe the world. We've always been on the forefront. We're making that balancing that chance between production and increasing production for a hungrier world, but also at the same time using working lands conservation. I had the opportunity to be in Worthington this last Saturday, where we dedicated a new piece of land in the middle of some of the most productive farmland in Minnesota to allow for hunting and allow for habitat. In Minnesota, some of the things that we can do is, first and foremost, we passed the most robust agricultural budget this year and provided for some of the relief that climate change is bringing. I think one of the things that we saw is we diversified our meatpacking industry. We now have opportunities for students to study meatpacking. It's one of the things my father's parents did. They had a small meat locker. I remember growing up working in that. Those are back now. We're teaching students to be able to do that. We're diversifying that, making sure that we don't have so much vertical integration. And then we're continuing to use the investments we make at the University of Minnesota and into our commodity groups to make innovations. We now drive on soy tires. We're going to see the opportunity in so many fronts to be able to use some of those value-added agricultural products. Minnesota does this incredibly well. We do it as well as anyone else, and our ag community right now is simply fundamental, as it's always been, to Minnesota's long-term growth.
Thank you, Governor Walz. Dr. Jensen, you have 90 seconds.
Well, Governor Walz thinks so much of agriculture that when he was on the committee in Congress, he didn't bother showing up to vote for the bill in 2018, and I think there was a newspaper in the southern portion of the state that excoriated him for his absence in determining what was going to go into that ag bill. But I think we need to do this. We need to recognize how important ag is. It's more than 30% of our economy. We need to understand that the agencies, especially under Governor Walz, have been heavy-handed. And the MPCA, the DNR, all of these agencies have got to start taking a posture where they're there to facilitate and be consultative rather than punitive. And that's a big problem. We need to understand that to grow ag, we need to know that the culture in which farmers do their business has got to improve. Regulations are killing farmers. We need to absolutely reduce taxes and make it so family farms can stay in family farms. I've made it very clear. Over my dead body, would I allow foreign corporations to buy family farms in Minnesota? We need to understand that treatments to the crops, to the seeds, to the soil have to be researched. We need to also understand that transportation is huge. We need to make sure the young people stay in our communities. They need to understand all the opportunities so they can connect with the workforce needs. And I think we also need to stop following California's lead. We don't need to do that. And energy is a huge issue for farmers, and I don't think we've done a good job there. We've got to be able to have more, if you will, competitive impacts, bringing better priced fuels to farmers, because diesel fuel is killing the farming industry.
Thank you,
Fertilizer
Dr.
costs
Jensen.
as well. But we've got to do better.
Thank you, Dr. Jensen.